We're a clinically led organisation. The founding doctors are all GPs by background.
Well, it's a robust standard of care throughout our processes, from the time someone makes a phone call to when a client leaves the room.
I feel like NPH focus more on the client, and it's more of a personal relationship with every different client.
Particularly with the new branding and the new clinic, we've got a springboard now to really kind of get our name out there and be able to support as many businesses as possible.
What we felt was there would be an opportunity for the business to grow into areas that were not currently being provided in the North East, particularly to a level that we felt we could achieve. We thought we could perhaps do as well, if not better.
Fundamentally, we kept coming back to the idea that there are 6 key areas that we deliver.
The exact parameters of those medicals differ depending on what sector people are working in and what the risks are in the job role that they're doing. And pre-employment screening and ensuring that people are healthy enough to do a particular role is an important part of that pillar for employment medicals.
For health surveillance, it depends on the actual company, what their environment is. If they're working with chemicals or substances or anything like that, then the screening would involve having a respiratory lung function test done as well.
So some employees will have very, very low sickness rates, and other employees will have much higher sickness absence rates. And it's our role really to help an employer understand what may be causing that, in some situations to see the individual and to make a medical assessment to see if there is an explanation why their absence rates might be high, or whether there is a problem, particularly with a prolonged absence. An employer might want to understand a little bit more about what's happening.
So health screening can take multiple different forms, but a lot of the kind of key interest that we get is regarding on-site clinics to do with personal, effectively health MOTs.
Health promotion is the way that we can support employers to inform and educate their employees about their own health and how they can make the most of it.
I think a lot of people, unfortunately, in our modern world rely a lot on other forms of relaxation, and drug and alcohol gets in the mix, unfortunately. So there's a need to educate people and to support people and to find ways of identifying where problems exist.
Newcastle Premier Health kind of came on our radar, I would say, more than 5 years ago, and we just liked their approach to things. They came in, they discussed how they would undertake the health surveillances, and we went from there, and it's been a success. We've been extremely lucky to have a super nurse that comes out to us year on year and who has built up a good relationship with our workforce.
NPH has really helped as an organisation to get our staff back to work, for example, if they're off on long-term sick, by providing support to staff, by providing support to the people in development team. Without that support from NPH, it would be difficult to bring somebody back into work, knowing that we'd met the guidelines, the regulations.
Trying to restructure what we do and how we do it so that the patient journey was much more understandable through our website, and the meaning behind who we are and where we've come from was better understood by people, and that fundamentally our clients understood the values that we try and aspire to. So all that's hopefully been represented in our new brand. So we hope that'll help businesses to sort of connect with us in a more purposeful way.